Good afternoon, friends. Myself, Dr. Atul. I'm your faculty for the essentials of sports injury prevention and rehabilitation medicines. So it's week 6 now, lecture first. So in this week, we are going to learn about the sports injuries. How many types and what are the principles of rehabilitations and we will also discuss about the common injuries and their management. So now let's we start with the sports injuries. I just want to ask, are these injuries are different from the normal injuries? No, these injuries are as similar with the we face in day to day, or either any common man suffers. The only thing is that sports person suffers quite common. The only difference between the common injuries which another person suffers, sports persons are more prone to these injuries as per their specific requirements. So, and we can divide these sports injury into two types: acute injuries and overuse injuries. Acute injuries, like when there is a single episode of trauma, oblique, any overloading or single single exposure, and that is we say acute. And when we say chronic, there is a continuous overloading or continuous minor trauma which leads to the injuries which say overuse. Overuse injuries are more prone in sportsmen rather than the and acute injuries are common in the normal person, any civilian or any other person. Sportsmen also suffer, but these injuries in the sports person are more common. So, what are the common acute injuries? You might have heard hamstring sprain, abrasions, or fractures. They are quite common during playing, and they all are occurred with a single episodes of trauma. And overuse injuries, when minor trauma is overloading is due to faulty. Overuse injuries generally occurs due to some intrinsic or extrinsic faulty mechanism. Because of that, the overdose of loading and the remodeling of the body got the overuse injury generally occur due to prolonged overdose of overloading due to faulty intrinsic or extrinsic factors. Intrinsic factors like his malalignment of joints, his weak musculatures, his deficiency of vitamin D, calcium, and extrinsic factors like running on hard surface, using inappropriate gears, oblique equipment, or wear teared shoes. They all are extrinsic factors. And when these micro trauma increases and simultaneously remodeling of the body is ongoing process, and when overloading is too much, then these injuries occurs. So like medial tibial stress syndrome, tendinopathies, callus formation, they all are example of overuse injuries. So first we study about the common injuries of we can in this table you can see in the bones acute injuries are fracture, periosteal contusion. What is periosteal contusion? Those superficial bone and you got stuck or something hit on the bone, there will be a small swelling, that is periosteal reaction. It is some sort of contusion over the periosteum or the superficial bone. And the overuse injuries of bones, stress injuries like stress reactions, stress fracture, the osteitis, periostitis, apophysitis, enthesiopathy, osteophytes, and bone spurs. So these are the common bone injuries, acute simultaneously overuse injuries. At the joint, commonly dislocation or subluxation, and the overuse is stability or synovitis osteoarthritis because of joint recurrent dislocation or subluxations. So if dislocation occurs once and the person strengthen up the dynamic and static stabilizers of that particular joint, so the dislocation doesn't occur or reoccur, then it is an acute injury, and chances of any further trauma or overuse injuries are less. But if recurrence of dislocations keep occurring, then chances of overuse injuries like instability and osteoarthritis at later age can be developed. So a tendon stress over the tendon increases too much and it can't be hold uh, longer, then the tendon got rupture, and if it is complete, then we say complete tear. And if there is few fibers has broken, then we say grade 1, grade 2 and grade 3, that is complete tear. And the chronic injury of the tendon is tendinopathy, like golfer's elbow, tennis elbow, or like that. In the muscles, the acute injuries are strain, tear, or contusion. When some extensive acutely damage our muscles, like some uh, ball hit our thigh muscles and a contusion occurs, or a collection of blood occurs on the thigh muscles, it is called contusion. It's a single episode. And when there is a chronic injury is there, regular some trauma or regular some insult to that body part is going on, and that remodeling or tissue healing is not occurring, that causes the overuse injuries like chronic compartment syndrome and DOMS. DOMS, though it appears after a single episode of but it's a kind of overuse. Or why overuse? We have crossed the limit of the muscle in a single episode. So the and it pain, that is delayed onset muscle soreness, appear after 24 hours to 48 hours. So it also comes in the overuse injury, though it generally it appears at the beginning of when we change some exercise, or we change some of our exercise pattern, or we include some new exercise that uses a different fibers of muscles, uh, or a person who is less in musculature, he start doing some sort of exercise. So this uh, DOMS, that is delayed onset muscle soreness, occurs. And for the skin, acute injuries, any kind of blister, abrasion, or lacerations. Or in the overuse injuries, then chronic irritation is there, like when your shoes are not fit to your size and you are keep wearing that, so it makes a blister. And callus formation, thickening of the soft skin, become soft skin is known as callus. So these are the common sports injuries which you might have heard quite commonly. Now we will discuss one by one why these acute injuries occur and what is the initial treatment and how one can prevent those injuries. So how we can prevent the acute injuries? We can prevent acute injuries by follow the rules of that particular sports. That is the guideline which is given. Don't foul play the game. Sometimes while playing, we silently hit our opponent. That is some sort of cheating or some sort of not a good thing. And by bargaining this, that your fellow sportsman got injured, or you have might have seen so many examples when in the football or any other competitive games where two teams are participating, like football, hockey, they hit their fellow player uh, intentionally, and the other person got injured. After that, referee put a red card or yellow card or some sort of penalty he gives, but the injuries to the other sportsman has already occurred. So if you follow the rules, the chances of injuries on the ground will be less. So when we do proper warm up, so the chances of injuries are very less, and performance of particular sportsman got enhanced. So as I have taken my in the my previous lecture, so warm up at least for 5 to 10 minutes, or in the competition, it depends on the competition or a normal training, and warm up is also be planned accordingly. For the normal training it's different, for the pre competition it's different, for the competition it's totally different. So during competition you are not going to exhaust yourself completely, you have to save your energy and your josh for the competition. So the warm up for the competition phase will be different. So, and another thing how we can protect ourselves is wearing protective gears like knee cap or a helmet or a proper size of your gloves, your knee pads, your genital guards. So all these equipments are to prevent you from the injuries, that is acute injuries. They also cause some injuries if these equipment are not properly fit. Like if you are using tightly fit shoes, so it might give you a blister or it might affect your performance. So selection of gear and wearing a proper gear is also important. As I have mentioned, you respect your fellow player. So it is very much required and important to reduce the injury rate on the playgrounds. Timely replace your gears, as every shoe or every racket comes with a life, and the wear tear part is also there. So you have to change your sports wear and sports gear or equipment time to time. Otherwise, if you are playing with the faulty equipment, you will be landed in the some sort of injuries. Like a person or an athlete who is running for almost a year or plus with the same shoes, and he is not changing his shoes, so he is prone for injuries, because every shoes comes with a particular life, that is this much of kilometer he has to run, and that much of 6 months his the gel will remain normal. Other after that, that gel cushion will be drying, and it will not give that much cushion or that much absorption of the stress or from the ground reaction force. So these things athletes have to keep in mind, and he can prevent acute injuries as well as overuse injuries also. And while you are practicing or you are doing training, you must include your plyometric and proprioceptive exercise at least twice or in your training schedule. These exercise coordinate your mind and body, and prepare your the increase your agility and your perception or your awareness about your body. So while you are suddenly you are getting fallen, so these exercise and these awareness or these exercise awareness exercise make you, these plyometric and proprioceptive exercise makes you aware, and so you can save yourself while falling down, and the less your reaction time will be so fast, so you can save you can save yourself from injuries. And like hydration and nutrition is also a part of your injury prevention. If you are hydrated, your performance will be down, your decision making power will be less. So it's you have to make yourself hydrated. And the common how you can check you are well hydrated or not, you just see the color of your urine. If it is lemon, like a lemonade, or a clear water, like, it means you are properly hydrated. Or if you the color of urine is dark lemon yellow, it means you are dehydrated. So you have to keep checking yourself regularly. And the slightest amount of thrust gives you the indication that you are already dehydrated. So keep taking water intake or a fluid regularly. It makes yourself hydrated, and your decision power during the game remain at utmost or topmost. And nutrition also, if you are exerting more and taking a less amount, so your muscles, your body is prone for injuries, because your the repair part is not properly working. So when we uh, not taking nutrition properly, then the protein required to replenish the muscle, the damaged muscle, or for the repairing of the muscles, is not supplied properly. So the wear tear uh, will be more, and the remodeling part or replenishment of the, or the repairing of muscles will be affected. So you will be prone for the injuries. And if you are not taking a proper calcium or a proper uh, minor element, then your performance will be affected. As I mentioned you during our previous slide, follow the rules and do respect your fellow players and play intelligently. So don't while you play intelligently means just before some very important competition, and you injured yourself while doing your training. So you have not planned your activity, or you have not done intelligently your preparation, so you got injured. So when some serious or some important tournament is there, so do training. So you do training in a manner that your competitive phase or your competitive fitness remain 100%. You can't take chance. So you do more or more skill training rather than the your strengthening training. And you can do some sort of uh, psychological training also, under which you can mentally prepare yourself. And after so much training, you require a relaxation also, and so your body get time for recovery, and your brain got relaxed. So so your recovery will be fast. And these relaxation exercise gives you for the to plan your activity also.